Thank you for joining me on this health-related quality of life talk. This is part of Attr 810, and we're going to talk about how the health-related quality of life, injury risk factors, the disablement model, and injury prevention all correlate together. As I said, my name is Beth Neal. I am a PhD student in the Curriculum and Instruction for Athletic Training Educators major here at Indiana State University. The specific class of Attr 810 is part of the requirements for the Doctorate in Athletic Training program that is housed within ISU. For today's presentation, we're going to talk a lot about the patellofemoral pain syndrome, or that PFPS, and how it relates within the risk factors, disablement models, and injury prevention. So we're going to start with the disablement model. So what is the disablement model? There are three different disablement models that are commonly used within literature, and this example of what you can see in front of you is kind of a combination of all three and using some generalized terminology that is seen throughout the board of the different disablement models. One importance of using the disablement model is to include an additional aspect of patient-centered care. So a lot of times clinicians will look at a patient and merely think of the pathology and how to improve their life based off pathology. But we need to remember that because the pathology happened, that there's a lot of issues that can occur within the person, not just at the specific site of injury. So as we begin, we're going to talk about the origin. The origin is also known as the active pathology, and this is at the cellular level of disablement. In our example here, the active pathology occurring is patellofemoral pain syndrome. As we move on to the organ, this is the impairment. So this is what the body system's level of disability is. So for someone with patellofemoral pain syndrome, they might show decreased strength, decreased range of motion, or pain within that joint that is affected by the patellofemoral pain syndrome. As we move on in the disablement model, we want to look at the person as a whole, and this is the functional limitation, or as I said, the whole person level of disablement. So because our patient comes in and presents with a pathology of patellofemoral pain syndrome, an impairment of decreased strength, decreased range of motion, and pain, they then may demonstrate the inability to jump at greater than 80% of their normal height, or an inability to squat for serve-receive. So in this example, a volleyball player is having issues within their sport because of the impairment caused by the pathology. As we continue on with patient care, we kind of want to look at the societal aspect of a patient. So this is the disability or the relationship to societal levels of disablement. Because the person is unable to jump at 80% or is unable to squat for serve-receive, this then hinders them to serve as a libero for their volleyball team. And so this starts getting into the person as a whole of what it can do for them. We want to make sure that we think of the patient as more than just an athlete, though. So this inability to jump, this inability to squat can hinder them in their everyday life. Patellofemoral pain syndrome oftentimes creates issues for going up and down stairs, as well as being able to just work out and maintain a healthy lifestyle, which a lot of people like to do. One of the biggest issues, though, for people with patellofemoral pain syndrome is someone who goes from a level of inactivity to a level of activity. So even though it's sometimes painful, getting up and moving can help decrease some of the signs and symptoms of patellofemoral pain syndrome. As we move on, one of the last aspects of the disablement model is the environment, and this is the societal limitations, so barriers. So loss of scholarship can occur because the person is no longer able to serve as a libero. They may lose their starting spot and then lose some of the spotlight that they would get at tournaments. Additionally, we know with the environment that having an athletic trainer or healthcare professional there or not can also impact the person both mentally and physically on how they are able to get back into activity. So we want to look at some risk factors. So what are some reasons that people suffer from patellofemoral pain syndrome? So one example is the shoes. If shoes are more worn down, their landing is going to be altered. In addition, the increased force on the body in landing can have potential risks. Some of these can also include like sand versus indoor. So what kind of landing surface is the participant landing on? Some of the intrinsic factors, some of these we can help as clinicians, some of them we cannot. There's an increase or a noticeable decrease of the knee flexion angle, and this can be due to tight quadriceps. We notice that there is a decreased vertical ground reaction force, so the person is not landing as properly as they should. And we see some other issues that athletic trainers are able to help with, such as decreased quad strength, decreased hamstring strength, and then because of an increase of the hip external rotators, we want to work on the internal rotators. Some other aspects that may lead to injury risk are an increased navicular drop for the patient or the knee abduction load. So how does this fit into injury prevention? As I alluded to before, walking is important for these patients to make sure that they don't jump from an inactive lifestyle to a very active lifestyle. We want to improve the jump landing biomechanics, increase the hamstring and quad strength, making sure that we are mindful of the quad to hamstring ratio, and making sure that there's an increase in hip internal rotation strength. So we're going to go back to this disablement model and kind of think about the fact that when we use injury prevention and are able to kind of get at the root of the cause, we're going to notice a decrease in the scores on health-related quality of life models. Some of these models are the RAND or the SF36, where we can see how the injury relates to the patient's everyday life. When we notice that there are issues within their everyday life, or we are able to help decrease some of the risk factors, we may actually decrease the reasons seen within the disablement model.